Hello everyone, my name is John Coakley and I'm currently a GA here at TAMUCC for the men's basketball team. I'm in my first semester of my grads program, and this is my voiceover for my 10-minute topic for Dr. Melrose and the Principles of Strength and Conditioning class, and it is over aquatic training and its relationship with strength and power. First off, aquatic training, what is it? As you can see, aquatic fitness is defined as activities performed in the water that promote and enhance physical and mental fitness. Aquatic exercise is a low impact activity that takes pressure off of your bones, joints, and muscles. Water also offers natural resistance, which can help strengthen your muscles. People of all fitness levels do use aquatic training to some point, whether it be as extreme as doing box jumps or jump squats out of the pool onto the side of the pool onto land, or just simply doing walking or simply just swimming for leisure in the pool. It is definitely beneficial to you as it does prevent hard impact injury and contact on your joints. When I was conducting the study one, it compared the effect of aquatic and land plyometric training on young basketball players. It it um it definitely focused on the strength, the sprint, and balance um, within the athletes. The risk of injury measured as well, and this entire study ran over an 8-week period. And pictured here is the USA men's basketball player DeMar DeRozan, who is a current NBA All-Star amongst the league, and he is a very well-trained athlete. After examining the study, APT, which is aquatic plyometric training, and LPT, which is land plyometric training, they both can improve strength, sprint, and balance. LPT poses a potential disadvantage. This disadvantage is an enhanced risk of injuries caused by external forces acting upon a joint that every moment exceed the structural integrity of the bones, muscles, ligament, and tendon. This basically means that there's no give. When you're doing the work, you do a jump, when you land, all this force is hitting your joints, and that's what potentially causing the injury. APT poses an advantage because it provides a proper environment for improved performance with lower risk of injuries in muscles, bones, and joints. Basically, the water, provides a good. It gives a lot. It's easier on your bones, easier to move. Everything gives you a good amount of resistance. You can always add resistance based on your workout or whatever you are deciding to do. Study 2. It compared the effect of aquatic and land-based plyometric training, just as such as study 1, except in this one, vertical jump is being tested rather than the sprint speed of the athlete. And also in this one, risk of injury is measured as well. Study 2 findings. Gains in the athlete's vertical jump were the same when it was compared from aquatic plyometric training and land plyometric training. Aquatic training in the knee-level water is equal to training on normal land. This was a huge finding for me because honestly, I never thought about the height of the water density before. I always automatically assumed all water would be susceptible, but after clearly thinking about it, it definitely opened my eyes. Water density needs to be increased to gain full benefits of impact reduction, and using the appropriate amount of water will reduce the risk of injury and overall impact on the joints. Like I said before, you need the right amount of water. If you're just jumping on 4 inches of water, you're basically going to hit straight cement, and that's just as bad for your joints and for any athlete or anybody of any fitness level that's trying to work on their body. Study 3. Effects of aquatic resistance training on mobility limitation and lower limb impairments after knee replacement. This one is more of a rehab setting, and in this one, mobility, muscle power in the cross-section area was the focal point of this study. The results of this randomized controlled trial showed that 12 weeks of progressive aquatic training reduced mobility limitation in people with knee replacement. Basically, after doing this, they were they they were losing the limitations, which is good because now you're starting to gain full range of motion, preferably without pain. It's definitely getting you back to where you used to be because knee replacement is one of the most painful things anybody could ever go through. It is definitely stressful on the body, and it's just, like I said, it's very painful through treatment and medication. It's hard to get through. The aquatic training was well tolerated, and thus water would appear to offer an effective environment for training muscle power and mobility after knee replacement. So basically, after they conducted the study, they realized that aquatic training was the way to go because it did, like I said before in the previous slides, that it does give the right amount of give on the joints. It is definitely healthier for the person that is going through this, and they don't have to worry about any external factors that may affect this because the water in a pool or a rehabilitation center is going to be pretty controlled. It's going to be at the right temperature, right depth, and that's what makes it safest for these patients to go through this rehabilitation. Study for the last study that I conducted, any research on, it is the effects of aquatic exercise training using water resistant equipment in elderly. Purpose of this present study was to evaluate the efficacy of aquatic exercise training using the new equipment for the elderly. POMS was also measured, and that's in the POMS it is the tension and anxiety. These elderly people were nervous that they would fall or they would get hurt doing daily activities. Therefore, they would prevent themselves from doing these daily activities, and it's hindered their day-to-day life. Also, if they wanted to work out, this was another barrier for them to overcome because they knew if they did a basic workout, it could lead to more injury on them rather than it be a person of a higher fitness level or of a younger age, just because they don't have any aging on their bones or their muscles or their joints. Study 4 findings. Elderly people were extremely tense and anxious when it came to everyday life. As it became easier to maintain posture, stand, and move, tension and anxiety in everyday life were alleviated with the improvement of strength of the lower extremities and balance function. The present aquatic exercise training using water-resistant equipment may be used by elderly to improve balance and walking ability, which are associated with the prevention of falls. Basically, through the use of this equipment, through the use of aquatic training, building their muscles, building their stability, it improved. It improved their overall morale and outlook on everyday life, therefore making them more confident to go out into the everyday life and perform these daily activities. It's getting more confident and feel better as a person. And that is exactly what exercise is about, is boosting self-morale and just getting you out there doing things that you never thought you could do. So lastly, in conclusion, aquatic training has many benefits toward people of all fitness levels. Whether you are a professional athlete like DeMar DeRozan, a young athlete who is just starting out in elementary ball or middle school ball, whether you're an elderly person, you're a retired athlete, someone who's never worked out in your life, or you're just getting to the age where things are starting to get a little difficult in life, and people in rehab, no matter what injury you come back from, water and aquatic training is perfect for you. It is a controlled environment that is safe and is monitored. Therefore, you are getting the right amount of work with very low risk of injury. Something that was common amongst the studies was the building of muscle power and overall strength of the lower limbs of the human body. Aquatic strength is the best way to preserve the joints from direct and impactful forces that may cause injury on land. Like I said before, you can't just hop into any water and expect to get the best workout. You need the right depth, you need the right temperature, you need the right resistance. You need to make sure you are attacking your workout with not only the right technique, making sure you're doing the right workout that's targeting the area you're trying to get better at or rehab. You just need to know, you need to take all these things into account so you know you're getting the most out of your workout as possible. And lastly, here are my references of the journals that I use to study. Thank you very much for listening to this presentation. I hope everybody here has a great day and great things going on in your life. Thank you very much. Stay safe.